a potential breakthrough in pain management. New synthetic opioid shows lower addiction risk in rodent studies. A new synthetic opioid, developed to combat severe pain, may offer a safer alternative to highly addictive substances like morphine and fentanyl. Recent research suggests that this new compound, known as DFNZ, could provide potent pain relief without the extreme respiratory depression or intense euphoria that often leads to overdose and addiction. The challenge of modern pain relief. The medical community has long faced a double-edged sword regarding opioids. While these drugs are unparalleled in treating pain from surgery, trauma, and chronic disease, they carry devastating side effects. Euphoria. By flooding the brain with dopamine, opioids create a high that drives recreational abuse. Tolerance. Patients often require increasingly higher doses to achieve the same effect. Respiratory depression. High doses can slow or stop breathing, which is the primary cause of fatal overdoses. Historically, a class of potent opioids called nitazines was developed in the 1950s. Though they were 1,000 times more potent than morphine, they were largely abandoned due to their high overdose risk. Recently, however, nitazines have reemerged as dangerous street drugs, highlighting the urgent need for safer, controlled synthetic alternatives. The DFNZ discovery in a study published in the journal Nature, pharmacologist Michael Michaelides and his team introduced DFNZ, a newly patented nitazene. The drug appears to solve two major problems associated with traditional opioids: reduced overdose risk. Unlike many other nitazines, DFNZ does not suppress breathing as aggressively. Lower euphoric potential. The drug does not trigger the massive dopamine surges typically associated with the high that leads to addiction. Testing addiction in the lab to evaluate the drug's addictive potential, researchers conducted self-administration tests on rats. Using a lever-pressing system, the rodents were allowed to trigger their own doses of either DFNZ or morphine. The results provided a nuanced picture of the drug's profile. Addictive potential. Both drugs were pressed by the rats, indicating that DFNZ still possesses some addictive qualities. Withdrawal severity. Rats deprived of morphine showed much more intense withdrawal symptoms, such as tremors and teeth chattering, than those deprived of DFNZ. Behavioral recovery. Rats denied morphine continued to press the lever in a futile attempt to get more, whereas rats denied DFNZ ceased the behavior much faster. Furthermore, the study explored DFNZ's potential as a treatment for opioid use disorder. When rats were given heroin, those treated with DFNZ or fentanyl pressed the lever significantly less than those given a placebo, suggesting the drug could help curb the urge. Use heroin, much like current treatments such as methadone. Critical questions and the road ahead. While the results are promising, experts urge caution. Dr. Natasha Swalve, a behavioral neuroscientist not involved in the study, noted that while DFNZ shows a weaker addictive potential, it is not entirely risk-free. Several key questions remain before DFNZ can be considered a viable medical tool. The pain factor. The current study did not account for how constant, chronic pain might influence addiction. Would a patient in intense pain be more likely to seek out the drug regardless of the euphoria? Dosage safety. Researchers have only tested pain-relieving doses. It remains unknown how the drug behaves at higher, potentially dangerous doses. Clinical translation. Moving from rodent models to human patients is a massive leap. DFNZ could potentially be used for the treatment of opioid use disorder, but rigorous multi-phase clinical trials would have to first demonstrate its safety and efficacy. Michael Michaelides' conclusion: DFNZ represents a significant step toward decoupling pain relief from the high risk of addiction and fatal overdose. However, with rigorous clinical testing and regulatory hurdles ahead, it may be at least a decade before this compound reaches hospital wards.